Good evening, everyone. Good evening, classmates. Good evening, ma'am. My topic for this evening is about the Progeria syndrome or Progeria disease, prepared by yours truly, Catherine T. Almocera. Now, let's get started. What is Progeria? Progeria gets its name from the Greek word geras, which means old age. The classic type of progeria is called Hutchinson-Gilford progeria syndrome or HGPS. Dr. Jonathan Hutchinson and Dr. Hastings Gilford originally described the disease in the late 1800s, and progeria is always fatal. So the name derived from the name of the two doctors. So this disease is not easy. It's not the same with the other diseases that we have heard because it's a rare genetic disorder. So progeria is also known as the HGPS. What I have say a while ago, it is the Hodgkinson-Gilford progeria. So there is a movie named Benjamin Button Disease. This is a short story or movie. It's about the curious case of Benjamin. If you have time, you can watch the movie. It's a short story in a fictional. So it's about a baby that was born niya tigulang siya and then later on naging bata siya. So try to watch it and it's a good movie. So progeria is a rare genetic condition that results in child's body aging rapidly. So a mutation in the element gene causes progeria. Most kids with progeria don't live past age 13. The disease affects people of all sexes and races equally. So about 1 in every 4 million babies are born with it worldwide. So about in a 4 million babies na nag-iinaanak na ay isa dira na naay progeria. So it is a genetic disorder. It's because of the genes. Once the genes is not mutating correctly, so na ay tendency that the child that will being to be born have this kind of uh, disorder, genetic disorder. So when we see progeria, ano siya you are aging 10 times rapidly. Dili siya pareha sa normal nga aging process sa usa ka tawo. Kung sa bata, if you are 2 years old, your face looks like 2 times and 20 years old. So some babies have ilang face is like ilang edad is 10 years old but ilahang body and face is 50 years old. So a single mistake in a certain gene causes it to make abnormal protein. When cells use this protein, katong abnormal protein, it is called progerin. So they break down more easily. So this leads kids with progeria to age quickly. So these are the symptoms of the progeria. Slow height and weight growth, a bigger head, large eyes, which they can close all the way, a small lower jaw, a thin nose with a big tip, a thin nose, ears that stick out, veins you can see, and a slow and abnormal tooth growth, a high-pitched voice, loss of body fat and muscle, hair loss, including eyelashes and eyebrows. Kita na to, wala na sila yung mga eyelashes, wala na yung eyebrows, and also thin and wrinkled skin that shows their look. This is the picture. Makita ninyo dara ang pictures with progeria. The large head, baldness, ang mata, long thin big nose, wrinkled skin, small jaw. Like, kato nakita to ninyong sa The Lord of the Rings, nga katong creature dito. Pero dili in ato ang dalunggan. Like, same ato. And I have here the picture. The 1-year-old pa, normal pa iyahang face. Pag 2 years old, something makita na gyud ninyo ang iyahang symptoms. Like sa iyang mga symptoms na makita nimo sa progeria. The body, the child is 12 years old, but his body is 50 years old above. So ang walay kilay, ang iyang ilong, iyang baba, makita ninyo mga nagaugat-ugat na naman, makita ninyo mga veins sa iyang agtang. So ana na. So ing ana ang iyang itsura. 8, 10 years old, 12 years old. So, makita gid niya noticeable na gyud nga naay progeria ang isa ka bata. So, as children with progeria get older, they get diseases. You'd expect to see in people age 15 older, including bone loss, hardening of the arteries, and heart disease. So, children with progeria usually die of heart attacks or strokes. Kasi mostly dito gid ginaigo sa progeria, mostly ang heart, ang mga arteries, hardening of the arteries. So ilang mga bones dili na parehas nga sa mga bata-on nga kusgan pa. So yung ana. So progeria doesn't affect a child's intelligence or brain development. A child with the condition is not more likely to get infection than other kids either. So the child's intelligence, if smart ang child pag anak nimo or unsa pa dira, dili siya maapektuhan. So progeria causes and risk factors. First is about a mutation in the lamin A or LMNA gene causes progeria. The gene makes a protein that holds together the center of a cell with progeria. Then the body makes an abnormal form of a lamin A called progerin, which leads to rapid aging. So researchers have not found any risk factors for progeria, and also it is not inherited or passed down in families. So we should not worry kay dili siya inherited. It's all about the single mistake of our genes nga mabuhat dito inside our cells. That's why magkaroon ng abnormality. So, the symptoms are noticeable. Paano i-diagnose? It's likely that a pediatrician will spot them during routine check-up. So, kung magpa-check up ka, dali lang siya makita siya kahit dali lang mababalaan. So, if you see changes, if you have a child, so these are the symptoms. These are the changes na makita ninyo. I-physical exam sila, test hearing and vision, measure ang pulse, ang blood pressure, and i-compare ang ilang height to other child at the same age. So naabay treatment ng progeria. Sad to say, there's no cure. Naabay tambal. There's no cure for progeria. But na mga treatment that can help ease or madelay ang disease ang symptoms sa disease. Na medication, diet changes, ibababa ang cholesterol sa bata para ma-prevent ang blood clots, and also na mga inumo like aspirin, low dose of aspirin para ma-prevent ang heart attacks and strokes. And also na mga like sa growth hormone nga maka-help build sa height o weight sa bata. And also, the FDA has approved lonafarnib or Zockinvay to prevent the build-up of defective progerin. So, if you which can affect the heart. So, naay kaning lonafarnib, maka-prevent ni siya nga mag-build up tong mga defective progerin. Kasi pag hindi yun siya ma-stop, yung mga defective progerin, sige hapon siya produce ato. Mapaspas ang pag age sa naay progeria. So, treatment can help ease or delay some of the disease symptoms. Physical and occupational therapy can help your child keep moving if they have stiff joints or hip problems. Surgery, some of children may have coronary bypass surgery or angioplasty to slow the progression of heart disease. So, basta na ay mga progeria, if you have the progeria, mostly mga heart attacks, mga strokes mo na siya. So, kung sa balay at home, kids with progeria are more likely to get dehydrated. So they need to drink plenty of water, especially when they're sick or it's hot. So small meals more often can help them eat enough too. So cushion shoes or insert can ease discomfort and encourage your child to play and stay active. And also sunscreen can help use it if the children will go outside, use sunscreen. So, progeria complication. Children with progeria usually develop a condition called atherosclerosis, which hardens in slow blood flow from blood vessels that carry nutrients and oxygen to your body. So, most children with progeria die of heart attacks and strokes related to atherosclerosis. Similar condition with progeria is what we call the Wiedemann-Rotenstrach syndrome and Werner syndrome, which are similar to progeria. It is inherited, but both of these syndrome is cause about rapid aging and shortened lifespan. While progeria, dili siya inherited, but the Werner syndrome are inherited. So, parehas lang sila na nagapapaspas sa imuhang aging o nagapa-shorten sa lifespan sa usa ka bata. Na instead na imuhang taas pa imuhang dapat bata pa ka, nahimo na kang tigulang tungod sa single mistake sa imong genes. So, na diri sa Philippines, we have Anna Rochelle and one of the Asia's oldest woman kasi ang iyang edad is 19 years old but her body is 150 years old. So, he suffered progeria. So, most of the sufferers nga na progeria don't live an average of 14 years but si Anna Rochelle nakaabot pa siya 19 years old before siya namatay. So, in the picture, si Sarah Geronimo, I know that you know her. And also, the other one is Anna, nga nagasuffer sa progeria. She died last year 2016. So, we have also cases here. And also, while I'm scrolling the internet a while ago, year 2022, na ay namatay of about 44 years old. So conclusion, Huskinson-Gilford progeria syndrome shows how genes, cells, and getting older are connected. Even though it's rare, it's important for doctors. It help us learn about getting older. So, ang atong genes, ang cells is connected how our body works, paano ta nagiging old. So, and also, kaya minsan may naay ang edad is 20 years old but ang face is like 40 years old. And also kung na some of the ano po nakita nato ng mga artist no na anay 50 but their looks like 30s. Kadepende siya kasi sa genes, sa cells, how we get older, and also sa everyday po natong ginabuhat. So, I have here to share to you food for the soul. You have two hands, one to help yourself and one to help others. It is by Aubrey Hepburn. And I have a video to share to you na about explaining how progeria, how the LMNA gen nga na siya naka-affect sa cells why nagkahitabo ang progeria.